My hello to all listeners. I am Dr. Sachin Arora, psychiatry faculty. Today I have the honor and pleasure of welcoming with me another FMG ranker, score 170, Dr. Wadae from Shillong. Great to see you here, Wadae.
Great to see
Congratulations
you,
on your
doctor.
FMG result.
Thank you so much, doctor.
Thank you for being with us. I mentioned that you're from Shillong. Please tell us more about yourself. Where did you graduate from?
I did my MBBS from the University of Perpetual Help, which is in the Philippines. So I passed my MBBS from there.
So when did you actually came back to India to start studying for FMG?
So I was there for 5 years. So I came back last June. So I was back in Shillong for 1 month. Then after that, I traveled to Delhi to do
Hmm.
my to join DAMS and to think. So I started studying from there.
What was your reason of joining DAMS-Delhi face to face?
Actually, my brother had a lot of experience because he did his super specialty from Safdarjung Hospital. So he was quite familiar with how coachings and all work. So he suggested me to join DAMS,
Great. So your brother is also a doctor and he studied from DAMS probably previously.
probably previously.
Yes. So how was your experience with face-to-face classes of DAMS?
Face-to-face classes were good, doctor, because I go there and it's like regular classes. And after every 2 hours, they give us break, which is quite good because so that I can like freshen up my brain and all. And we have ample amount of time to study, to go back home, and it's not that overwhelming.
Okay. So you kind of finished the preparation in 5 to 6 months of time. Is this time period sufficient to prepare for FMG according to you?
Yes, doctor, I feel it's more than sufficient, but like my suggestion would be like, please use these early months to build up your concepts because if you keep on backlogging towards the end, it'll just create an unnecessary headache for you because you'll have to study and keep on mugging up stuff. So it'll be quite hard.
So you kind of finished the syllabus along with the DAMS batch itself?
Uh, Not quite, doctor, because my mistake was that some of the main subjects, I took them quite lightly. But then when it came towards the end, I had to really struggle and like push myself, and there was lots of stress and also that was one of my big mistake.
Hmm. So you would like to recommend students to avoid that mistake.
Yes, doctor.
Any other do's and don'ts from your side in general for the future FMG aspirants?
One Another advice would be like to please trust your DAMS teachers, your mentors, because you have to follow whatever they say, and please don't feel like you're missing out on anything because you're not. Actually, I feel like
Great.
whatever you're teaching us is more than enough.
Thank you so much for that.
Welcome.
And how did DFX help you in revision?
DFX was a great help because actually it was getting too overwhelming towards the end, but then DFX had all the key important points, so it helped me a lot. But then I do wish that I could have revised maybe one more time because I probably did 2 rounds of revision for DFX.
Great, but you have scored pretty well. So was the paper doable from DAMS notes itself?
Yes, doctor, it was very doable, and all of your suggestions, especially your videos towards the end on how to tackle and how to like how to chill a bit to not take too much stress and all. So that helped a lot. But then paper one was quite tough for me because my weak point was biochem, and some of those subjects were quite hard for me. But then other than that, it was quite okay. And all of your recommendations for psychiatry, like they all came back from the classes and all. So yeah, it did help a lot.
Great. Great to hear this. And I'm sure that your juniors and colleagues who are listening to you would certainly be benefited. Before we finally close this interview, any person you would like to thank today from your parents, from your family, from your friends or teachers?
Yes, so I would especially like to thank my mom and dad and my elder brother and his and his wife, my sister-in-law. So they were really supportive towards what I did. So they were really supportive, and that helped a lot. So my request for all the students is also like to please not forget about your parents. At least just text them every day, good morning or something, because that helps a lot. It'll boost your morale. And especially from DAMS, I feel like all of the doctors and all of the faculty members, they're really supportive, and that's really important because they keep on pushing you. So yeah, that's what.
Thank you so much, Valeed, for being with us. And thank you so much
Thank you.
for giving your time. Thank you.
Thank you, doctor.